Good afternoon, everybody. This webinar is conducted by Aid at Last Medical Tourism and StemRx. So Dr. Mahajan is online. He would be starting with the session. Thank you.
Well, I'm Dr. Pradeep Mahajan from StemRx Biosciences Solutions. Just to give a little background of my work, particularly regenerative medicine and stem-based technologies, is on the integrated management of neurological, orthopedic, autoimmune, cancers, degenerative conditions, stem cells or regenerative medicine as a central core factor of the treatment, and the allied treatments which help to increase the proliferation and development of the stem cells in the body, which includes different kind of technologies using peptides, growth factors, quantum energy medicine, WIP technologies, resonance technologies, and various very important type of microcurrents. To let you know about me, my assignment is adjunct professor of surgery at Indiana University in USA in the Department of Surgery and Regenerative Medicine. I am also a member of American Society of Regenerative Medicine. At Cooper Hospital, I work as an associate regenerative medicine expert. And good news for you is that currently I'm a board certified physician from American Board of Regenerative. So I'm a diplomat for the American Board of Regenerative Medicine. Various clinical trials in US, in India, we are conducting. We have 5 patents at our rate, and also 27 research papers published on various indications. And these are on the process going on day by day. The most important, what we have done, particularly when we talk on pediatric cases, neonate cases of neurological development, orthopedic conditions, as well as the aging degenerations. StemRx has an experience of more than 10 years, and I'm well recognized, particularly in US, where I work as an adjunct professor. I'm also a board certified member with the FDA, Drug Controller of India, where I was a board member to draft the guidelines for stem cell therapy for Government of India. To add, at certain universities like ITM University, then University of Maharashtra Government, MUHS, I am a fellow running a fellowship program for stem cell regenerative medicine approved by Government of India. Before we go ahead, I would like to just build up a small information for you about the stem cells. Rather, stem cells is a small part of regenerative medicine. Regenerative medicine is a big umbrella, which I'll show you in subsequent slides. These are undifferentiated cells present in our body. They are not specialized. Cell is a small functional unit or a building block of our body. And when it is a primitive, that is undifferentiated, those we call as stem cells, which has a power to proliferate, increase, and also differentiate to different lineages, and also produce similar type of stem cells to maintain the pull of our body. These cells, particularly stem cells, when we talk, we are blessed to have these cells as having spatial powers nature has given to make various organs of our body differentiate into various type of cells. Having this knowledge of cells differentiating into different type of cells, we can use this knowledge to build up our technology of regenerative medicine stem cell therapy. In the slide here, if you see the first picture in the slide, what you see, a single embryo is made up of from a sperm and ovum, which makes a functional egg. This egg carries a 50% genes from the mother in the ovum and sperm from the father, and make a new genetic code of your life when you are born. So this is a new genetic code, which has come 50% from mother and 50% from father. So a cell which has got your life genetic code of developing your entire body has to be considered as the master cell, which has got all the information. Hence, we call this cell as a stem cell of our body. These cells are present in the bone marrow at the age of 3 to 5 days. When mother doesn't know she's pregnant, the cell differentiates into two layers, one outer layer which makes the placentine cord, and the inner cell which makes the organs in the body like this. They are started, but this step of making tissues in the body is called ontogenesis. And these cells which are making tissues will start making organs, what you see in the picture here. Umbilical cord connecting to the mother's uterus with the placenta, and the baby developing here with different tissues and parts. And by 6 weeks ahead, the entire baby starts taking shape, and by 6th month, the baby is mature. When the baby is born, it is 2.5 kg, and the baby grows, it becomes 60 kg. It is 12 inches by 18 inches here, and here it will be 6 feet. This indicates that this growth of baby from 2.5 kg to the adult is done by the bone marrow stem cells. Okay. Now here, one thing you should remember, if the child after taking birth of 2.5 kg suffers from a bone marrow disease like cancer or a plastic disease, the baby dies. And the moment you do bone marrow transplant, new bone marrow is transplanted with the matching stem cells from the healthy donor, the baby grows back to 60 kg. This indicates how important is the bone marrow to grow your body weight from 2.5 kg to 60 kg. Now, this story of single embryo, 250 trillion cells of your body is coming from a single cell. Now, this cell makes your multiple cells of your body. They make the tissues, they make the organs, they make the body, and body grows. Now, the story is important for you to understand for the reason, any organ here the baby has developed has come from these cells. Now, there's a simple example. If you take out your hall or your home for maintenance, your walls of the home are made up of cement, steel, bricks. All these things make the wall. Suppose the wall you want to repair of your home, you cannot use plastic. So you have to use only sand and cement and bricks and steel to repair it, because the wall is made up from these material. Now here, suppose your organ is damaged here, and your organs are developed from the tissues are making these organs, and tissues are developing from these cells. So it's a simple logic. By nature, the organ which is developed by the type of cells, only those cells can repair the organ. The way wall cannot be repaired by plastic, it has to be repaired by the sand and cement. So the same thing applies to the human body. In the world, any object developed from specific material, that same material has to be used to repair the organs. So this function called the stem cell or regenerative medicine using your own cells to repair. So if you see in my talk, everywhere I mention, you carry your repairing tools in your own body. So we have to use these repairing cells in your body, which otherwise also are repairing your body properly. These cells can regenerate, they can specialize, they can differentiate. They also produce internal signals and external signals in the body to maintain the function of the body. In the organ, they are present in a niche area where they produce the organs, cells, as I showed you earlier one, and the stem cells like this, progeny cells, by two type of divisions. One is called as symmetrical, other is called as asymmetrical. Now, this inner cell wall is one which makes the all type of cells in the body. So these are embryonic stem cells when we take at the 3 to 4 day stage. The second type of stem cells are adult stem cells, which are present in your bone marrow, muscle, brain, and other tissues of the body. Whereas when we use the cells from other sources like cord tissue, placenta, or any other organ of the placenta like cord blood, amniotic fluid, then they are called as allogenic sources, so other sources. And if you use your own cells of the body, we call them autologous stem cells. In adults, we have sources like bone marrow, muscle, fat, teeth, brain, testicle as a stem cells. In the bone marrow, these stem cells are present in the red marrow and yellow marrow. Yellow marrow has got more stem cells, mesenchymal stem cells, and red marrow has got hematopoietic, which makes the blood and blood parts. This bone marrow constitutes the 4% of the total body mass and maintaining the wear and tear, repairing of the body. In the bone marrow, if you see, take out a small piece from as a biopsy and enlarge it to see the type of stem cells present in the bone marrow. We will see in the red marrow, the blood-forming stem cells and the other cells, MSCs, which are making neurons, marrow cells, osteocytes, and osteoblast, osteoclast, chondrial cells, all they come from there. This bone marrow is a dynamic tissue, 24/7 in action. As I told you, it has got a main role to make the bone and also resorb the bone. And the same cells has got mesenchymal cells, which can be used to repair in the body. These adult stem cells have a special powers to differentiate into other tissues. Now, when we want to see the cells which we want to use for repairing, these cells come from a biological source. And what we practice in the clinical as a surgeon myself uses pharmacological drugs and surgical skills to practice. But remember, using pharmacological drugs and surgical practice, I have limitations in conventional therapies so that we understand that degenerative conditions like Alzheimer, Parkinson's, developmental diseases like autism, cerebral palsy, ADHD cannot show the improvement. That is the reason we have to see the new microscopic miracle workers, which are the stem cells having special power in the body. They will work like a magic bullet, and this is a hope, not hype. This is a fact, not a fiction for you. This entire regenerative umbrella has got 4 functions to do: regenerate, restore, replace, and repair the tissues of the body using the allogenic sources, MSCs, hepatocytes, autologous cells, scaffold, growth factors like VGF, beta cells of pancreas, neuroprogenitor cells, and many other sources. The ultimate goal for all of them is to repair the brain, bone, muscle, tissue, lungs, heart, everything. The breakthrough of the science, as per the scientific reporter, 20 years before, indicating that none of the scientific research in the space science or computer science can change the quality of human being, but the tissue engineering and genetic medicine and stem cell science can change the human life. Now, ultimate autologous therapy plays a role, as I said to have a very safe and without side effect treatment. The results are very efficacious and can be done without surgery, using your own cells. That's the beauty of this science. Looking at the brain, developing brain, we should understand the organ which was once upon a time of very complex, because it was never taught in the schools, by opening or taking a biopsy of the brain when we studied in the medicine, the textbooks, what we read and learn. But now having the technology like spectrometry, high-end MRIs, PET scans, we can have an access to the brain to define the functions of the brain. And that is why we at StemRx can map the brain, and functional unison of the brain means entire brain of this baby functions with unison, means connecting to each other. Now this baby born, if you see the innocent face, you can understand the baby did not have spatial connections in the brain, still develop, because they will develop with the milestones as the baby grows. Those we call the milestones. When the baby speaks, when the baby walks, when the baby crawls, when the baby learns to balance, when the baby learns to give a response. With a smile, emotion centers are developed, which are present in hippocampus and amygdala, which play a major role in the disease like autism or ADHD. The early experience of the brain was not very responsive for the reason we were not knowing details of the brain. But now we have understood brain is very responsive and plastic. That is the neuroplasticity. And the neurons, if you come to my lab, I will show firing neurons, the way they fire electrical impulses. And these neurons have been interacting with the external experience, and this experience makes the formative experience from the child's environment to develop the brain and connect to each other. Now, this experience of the brain plays a major role to interact the genes of the neuron, and they work in uniqueness. Orthodox teaching in the medical school, in the school which we have learned, it is taught brain cannot proliferate. But the current science says brain can proliferate, new neurons can be developed, and teaching comes to develop to define the various parts of the brain. Now here, if you see the same brain, which I showed you, which was complex, has been easy by the new science by defining various parts of the brain. And each part of the brain, like parietal lobe, function, sensation, perception, integration, frontal memory, motor, language, judgment, temporal lobe, visual, auditory, language, recognition, new memories, occipital, visual processing and balancing areas of the brain. Now this indicates now we can map the brain by various scans and define which part of the brain is not functional, developing problem, and that accordingly we can target to improve. When the baby is born, this line shows the line of birth. Birth has taken place here. This 38 weeks of gestation shows 9 months of the baby in the womb of mother. After this time, at the birth, up to 20 years, the lines show the way various functions of the brain develop. If you happen to see these 3 lines, synaptic connections, dendritic development, myelination, means 1, 2, 3 lines. If you see, after the birth, towards the last trimester, they start really developing, like synaptic connections, dendrite and myelination. and it starts continuing after the birth even, highest maintaining this. Whereas these two lines, which is a cell proliferation line and progenitor cells, immature neurons, they reduce as we take the birth. There is no proliferation, stops after the birth, but at lowest level it is continuing. Means these three functions we have to catch to improve the function, because they will help us to catch up the milestones of the baby, when the baby is balancing, when the baby is running, when the baby is crawling, when the baby is talking, what becomes verbal. An overall picture of the slide shows initially neurons proliferate, then migrate, then differentiate. In the last trimester and the post-birth, they myelinate, connect to each other. The sensitive periods are one, when the synaptic connections are developing. These two are important for you in the treatment of particularly autism, cerebral palsy, ADHD, because if the neuroinflammation establishes toward the end of pregnancy or after the birth, the connections of various parts of brain are if affected, which we'll see, which are affected in autism, cerebral palsy. And these are the sensitive period. If you catch up during these two periods, we can have wonderful response improvement of the baby. The slides show proliferation, migration, the way these neurons are developing and migrating toward the surface and developing the new synaptic connections. Now, these synaptic connections we call purning effect. Purning effect means after the birth, the new connections develop very fast. And during this fast connection development, if you start the treatment, these connections don't disappear. Means if you make the neurons fire in the early period of 5 to 7 years time, they will not disappear. Means this is a theory of neuron. If you don't fire, they disappear. And during this phase of 1 to 2 years of age, if the neuroinflammation develops, the firing doesn't take place and these synaptic connections disappear. I'm making more easy for you to understand in autism what's happening. And we have to reconnect these synaptic connections, and StemRx is specialized to develop these connections in autism, ADHD, and other neurological disorders. The cell has got different parts, that is the body. This is called the myelin development, which is very important in the axon for electrical impulse. And axon terminals which connect to the other neurons. Now, this is very important for us. In all these developmental disease or degenerative condition, this part of the neuron is very important for us. If neuron doesn't fire, then this way the neuron gets damaged and the electrical firing stops or becomes slow. If the neuron maintains firing, the firing is in a symphony of music, or in the symmetry of the music, or like a music with a symphony, these impulses are firing and our body is responding to it. Whereas when they're damaged, the disease damaged circuits will disappear in neurons. The timing of injury for these diseases is equally important. At the time of birth, after the birth, and later on during the neonatal period. This is very important for us. At the earliest injury or detection, the best part of the development of the brain is very good. At StemRx, we have protocols designed which are called as sandwich protocol, where the inbuilt stem cells in the brain, which I have shown you in earlier slide, and the external stem cells from the bone marrow can be used for the autism, cerebral palsy, ADHD, Down syndrome, intellectual disability, Parkinson, post-polio, multiple sclerosis, and a number of diseases. Focusing on autism, if you see, the causes are n number of causes. No single cause is defined. It could be neurological developmental issue. It could be a small genetic problem. Particularly, you can see in the condition where the in females, where you find the autism, which comes in the form of genetic representation, whereas in other males, it comes as an environmental problem or where you can say neuroinflammation or microbiome as a cause. The facts are about the incidence and lifestyle responsibilities because of which nowadays autism is increasing day by day. Now, the standard interventions, like the way we play with definitive, some kind of academic program, vocational programs, skill programs, behavioral programs, social program, music therapies, various models of behavioral treatment, everything has failed to support the development. Similarly, we'll see in cerebral palsy, there are various types of cerebral palsy. This happens because of the lack of blood supply, that is hypoxic brain injury. And we can define them depending on the involvement of the brain. And this can be also again detected by mapping of brain. If the whole brain is involved, then multiple areas of the brain are not developed and damaged by this called the periventricular leukomalacia. Cerebellar part, where the balance is affected, basal ganglia affected, and this is called a cortical brain is affected. Depending on that, we have a different types of palsies. Now, this is the youngest child in the world treated at StemRx, 14-month, very, what you can say, worst condition of cerebral palsy, having convulsions, rotation of the eyeballs up, there was no development. And within 1 month, you can see the child, the weight is developing. And now the child is developing completely normal. If somebody is interested, they can always click my YouTube channel and visit and see the story of this young girl. The same girl which we have done, the India Book of Records has appreciated our work of hypoxic ischemic injury. Similarly, we have global developmental delay when the complete brain is affected. Intellectual disability, where motor conditions may remain normal, but intellectual functions are affected. Then Down syndrome, where we call it to be a trisomy 21 or translocation, where the one extra gene, now instead of 46, 47 genes are there, Y gene is extra, because of which the development of the brain and physical development is affected. And this is typically seen in the form of base of the nose wide strip, canthus of the eye are sprayed, height is short, the muscles are weak, the tones of the joints are weak, and intellectually they are very poor, these children. Now, learning disability, if you see lack of learning disability, having learning disability, there is nothing organized. And if it is, there's no learning, you can have an organization properly function of the brain. Alzheimer, you can see the area of the brain which is showing degeneration. And if you see nowadays, US or any thickly upper, even Europe has the highest number of Alzheimer disease patients. Similarly, Parkinson's, tremor disease, I call it as a motor disease. Then neuromuscular dystrophy, muscular muscular dystrophy has got also good results. Spinal cord injury, then conventional therapies of all these cells have failed. That's the reason we are looking for stem cell therapy. In bony diseases, MSKD I call as musculoskeletal diseases, hip joint, vascular necrosis, osteoarthritis, ligamental injury, non-healing fracture, frozen shoulder, various types of spondylitis, various types of joint problems, tendon injuries, muscle injuries, polymyalgia rheumatica, and fibromyalgia are well-treatable conditions. In the avascular necrosis, where the head is damaging, we use a technology, no replacement of the hip joint, but we repair the joint. In the slide, you can see the damage here, pre-treatment, and post-treatment, you see the head getting repaired here. Similarly applies to osteoarthritis, pre-treatment and post-treatment. If you see the pre-treatment, this cartilage getting damaged, space is connecting here. If you see the space is come up here, and the damage which you are seeing here in this joint is reduced here, completely reduced here. This is a sports injury where this ligament gets damaged. So we don't do surgery, we repair with stem cell technology. Now the bone fracture can be repaired using stem cells. Shoulders which are showing inflammation can also be reduced and treated by using stem cell technologies, though there's no need of shoulder replacement. This is a patient of shoulder pain, Zara from Oman, has done a wonderful improvement. Spondylitis, again, same treatment. Here we have introduced a beautiful, apart from stem cell, we have introduced non-surgical decompression of the brain, of the cord, spinal column. These are plantar fasciitis. Here we use stem cells, a daycare treatment or 2 days maximum, the pain disappears. Spondylitis, again, pain is here. This, again, the sacroiliac joint, this joint of the body is involved. So we treat this using stem cell technology and quantum energy medicine. If there's a muscle injury of the calf or thigh, can be repaired by using stem cell technology. Polymyalgia means entire body is painful, can be repaired using stem cell technology. Fibromyalgia, inflammation in the muscle of the body, can be treated using stem cell technology. Conventional therapies fail for MSK and other diseases, rheumatoid disease, type 1 diabetes, somatic psoriasis, psoriatic arthritis, multiple sclerosis, systemic lupus, inflammatory bowel, Addison, Graves' disease. These deformities can be corrected without surgery. Ankylosing spondylitis, where these joints are spine erected without surgery. We can make in type 1 diabetes new beta cells so that the beta cell production improves and antibodies can be reduced by using mesenchymal stem cells, and the child who is type 1 diabetes can be different, made a normal child without any insulin and lives a normal life. Here we have introduced a new technology which is called as a FMT, fecal microbiota transplant, to remove the bad bacteria from the intestine and use a healthy bacteria. Psoriatic arthritis, again, these psoriatic lesions arthritis can be treated using stem cell technology. Multiple sclerosis, myelin sheath is damaged. Here can be typical normal myelin sheath can be developed without any damage. Systemic lupus erythematosus, similar, again, these are the where it is affected. It is affected in almost every part of the body, and lungs, heart, blood, kidney, skin are all affected. Bowel diseases like Crohn's disease, ulcerative colitis can be treated using stem cell technology. Addison disease can be treated using stem cell technology. Graves' disease of thyroid, but thyroid problem can be treated using stem cell technology. Conventional therapy fail for autoimmune diseases, like these are the conditions in autoimmune disease, systemic conditions, which cannot be responded to normal treatment, kidney failure, dyslipidemia, then also cardiovascular, reproductive system problem. Infertility plays a major role with us. We can improve infertility organs into fertility organs like ovaries and testes. Metabolic syndromes, diabetes, hypertension, thyroid, and other conditions can be covered. Here, blood pressure, lipid, large waist, dyslipidemia, all can be repaired in diabetes type 2 using stem cells. In diabetes type 1 and type 2, the pancreatic insulin has been increased here to improve the renal function and improve the receptors of the cells. Here, we repair the receptors of the cells where glucose will be absorbed in the cell after stem cell, and then the other stem cell will be given. Here in type 2 diabetes, if it is an insulin producing cell which is destroyed, so that we always have to produce pill producing cells only. Other complications like hypertension can be treated, thyroid function can be treated, Regenerative therapy for systemic diseases. Eye-wise, we can treat that is like RP, retinitis pigmentosa, age-related macular degeneration, diabetic retinopathy, glaucoma, optic nerve injury. Retinitis pigmentosa is a disease where the rod and cones are damaged. Those can be repaired using stem cell technology and also a microcurrent delivered from the eyeball, particularly central part of the eyeball. This is from the eyeball, the photomodulation or lasers can be used to repair this from this particular part. Now this optic nerve, you can see we have technology where we can reach the optic nerve and transplant the stem cells at the neck to the retrobulbar injection type. Also the drop of the stem cells can regenerate the retina or optic nerve, and you can reverse back your technology or you by using most modern technology, which is called as a matrix and technology of current. Other genetic diseases treated at StemRx are sickle cell disease, which is present in the bone marrow. We do bone marrow transplant for sickle cell disease and try to regain the normal life to the child and stop the sickling as well as complications of the stem cell sickling of the disease. Down syndrome, as I told you, the symptoms can be corrected, ring protrusion can stop, and the hair will fall stop. All this will be using stem cell. Stooge-Weber syndrome is an ectodermal problem having skin and brain involved where the vessels are abnormal, and these are called as Stooge-Weber syndrome. Joubert syndrome, again a developmental genetic problem where vermis papillomavirus is not developed, depends ependular fossa disease and elongated superior cerebral protuberances. Now, in addition to this, we have seen that the deeper interpendular fossa or cellular hyperplasia can be improved with hyperoxygen chamber therapy also. Under 15 disease, most important is balancing and vision eyeball. Angelman syndrome, if you see, it is the cause of genetic disorder. It generally leads to genetic disorder and also leads to speech development, space, intellectual problems, all can be improved in Angelman syndrome. Upper syndrome, again characterized by genetic disorder. Conventional therapy phase. Now we have some programs on infertility too. Whether it is a male infertility or the female infertility because of thin endometrium, fibrosis, ovarian failure, primary, secondary, pelvic inflammatory disease, various vaginal infections like TORCH and viral infection can be treated for infertility. Now, usually for 2 months, if there's no conception, and then about 2.1 million women in the world are supposed to be suffering for infertility. Causes can be defined by variables, and these are in female, most of them, and also mixed causes. These highlight the impressive number of women undergoing infertility. In infertility, in the male also we have to consider causes apart from female causes. Now these technologies are smart technologies using stem cell technology. Now POI is a Poirier vaccine efficiency. This is very important for us. If the woman is 40 plus and there are no other treatments, then I would prefer on ethical ground to give justice to these women for giving fertility using cell components and growth factors and lifestyle changes to improve the quality of sperm and improve the repairing of the endometrial tissue, ovarian function, and all those things. Infertility in female, it could be POF, POSCD, Asherman syndrome, polyps, and fallopian tube obstruction. Thin endometrium, ovary, thin filament, and also normal biomaterial lung 8 millimeter and endometrial lung 7 millimeter. Polycystic disease where the cyst will have more of ovaries, that will be removed also in my stem cell. Pelvic inflammatory disease where the pelvic is inflamed around gets the infection, expels the baby outside. Vaginal infections, conventional therapy fail. So other diseases like sensorineural hearing loss, neuropathy, tinnitus, mixed hearing loss can be treated using stem cell technology. Now here, external source, from the external source can be punctured here and reach into the middle ear where the stem cells are released so that this organ becomes more functional and nerves start functioning. Neuropathy, by which the sound and all those things can damage the neuropathy nerve. So we can use stem cell technology to repair the neuropathy. Tinnitus is making the noise in the brain even at rest. This is a hum noise, a voice comes because of the cells in the brain auditory area. They are shouting, irresponsible situation, and this can happen along with the sensory neural loss or without the sensory neural loss. And this tinnitus is a very well repairable technology without technology. In the orthopedic migraine, frozen shoulder, tennis, cervical, calcaneal, fasciitis, back pain, media, rheumatology are treatable. Migraine, tennis elbow, calcaneal spur, carpal tunnel syndrome can be treatable. The beauty is that in all these treatments, there is no surgical role played. For you, those who are interested, they can visit my YouTube channel here and visualize the various conditions which are there. Just click on the center and you will get various videos. These are some of the stories of our patient. You can see this is a lung disease presentation done by me in the World Conference of India, where the top authorities are talking about my program, the way I run. This is an surgeon from AIMS, which will demonstrate you how we repair at StemRx. Next slide. One of the working outside of India, class but we have to connect it. Now, those who are interested, they could always visit my YouTube and see those stories. Now, the question remains, can we use neurons for the repairing of the brain? Now, applied therapy, as I told you, speech therapy, they don't make any sense to repair the brain. Here, if you see the child is making wobbling sounds, it's like noises. Now, noises are made by the motor area, and we are giving speech therapy. How the processing will take place in the brain. The area of the brain, vernix area is a separate where the processing is required. If the processing of the speech takes place, then the noise which child is making like a babbling will become automatically a voice of speech. So these are the technologies which StemRx has developed here. Now, can we use our stem cells to repair the brain? Yes, this is the neurogenesis which is present in your brain. Now, there are certain cells which are present, neural stem cells and neuroprogenitor cells in various parts of the brain. And these old neurons, when they die away, the new neurons replace them from various areas like dentate gyrus. Then the second area is subventricular zone. Then the third area is olfactory bulb. Likewise, there are many areas of the brain, striatum, which can function and give neuronal function to the brain. Now, this is sandwich protocol where I just showed the internal stem cells which are present in the brain can be stimulated, and exogenous we use from the bone marrow can be used, that is sandwiching between two sources of stem cells is called a sandwich protocol, where we use the mesenchymal, mononuclear, progenitor, VCL cell, nutraceuticals, growth factors, and various rehabilitation programs. In the neurological function of the brain, nutraceuticals play a major role. And these nutraceuticals, which are important to improve the brain, are like quercetin, carotenoids, which we use for the children to improve various applications by using vitamin A, fish oil, then EGCG, MitoQ, then we use beta-carotene, CoQ enzymes, then we use most important curcumin, silvimerine, Asiatic quercetin to improve the communications in the brain. Now, each which we use for our patients, these are the nutraceutical compounds and their functions are mentioned here, how they can help to develop the various parts of the brain. So the diseases where it can be used are these diseases. These are various supplements which we recommend to use for the babies during the course of development when we do at StemRx treatment. We have various blends like Brahmi is very good for the brain to improve ginseng, curcumin, vitamin C. Then also very good are there, particularly for the brain, we use immune cells, omega cells, spirulina, NMN-NAD, berberine, resveratrol, CoQ, thymoquine. These are the various very strong molecules to improve the brain as well as muscle tissues. These are various treatment protocols at StemRx, which we use these centers to use these various therapies. These are various technologies at StemRx can be used for technology, which we call functional energy medicine. And then the use of decompression. Now, overall rehabilitation includes stem cell therapy, nebulization, quantum energy, bioactive molecules, growth factor, fecal microbiota transport, and mitochondrial dysfunction repair in the patients with all neurological development. The most important part of the development is these are advantages. They are very simple, not very complicated. We use a natural way of repairing without any kind of need of surgery. They are safe and risk-free, and using stem cell in the body, and there are no tumorigenic risks. The sooner or better, the child will show the improvement in the initial improvements. So my dear friends, there's a conclusion to say is a hope, promise of regenerative medicine for neurology to make personalized tissue repairing kits for specific diseases which are making incurables curable. So dear friend, these are my various publications which anybody is interested, they can always visit my site. There are various patents which we have got approval from the patent ratios. These are the intellectual patent rights. These are various appreciations received in kind of media coverage. And this is my experience in US, my collaborators. This is my team, complete working with my StemRx team doctors, and these are my clinical rooms. This is my lab team, which is working 24/7 to bring the various kind of cell products for your treatment. These are my in-house facilities of the hospital, from suit to sample roofs. The future of medicine and stem cell can be used in various indications, from cosmetic to repair the tissues of the body. Any questions, my dear friends? I would invite your question session now. Those who have any questions, they can raise the hand or they can put their queries in the query box where we can answer those questions. Thank you for patient hearing. Mr. Maz, you can take the questions.
Yes. Shamira Saida is typing.
Actually, I'm Yusuf. I'm his spouse. Yeah. She's my spouse. Yeah. Can you hear me?
Well, we can hear. Go ahead.
Yeah, actually, thanks a lot, doctor, for giving this opportunity. It was a very nice presentation.
I did a very slow presentation for you people to understand. I did not go very fast.
Yeah, that's right. That's right. You know, my kid is nearly 13 years old, and he is speechless. And we already had stem cell therapy in Neurogen done by Alok Sharma. We already had 3 sittings, and he's still not showing any kind of, little to no improvements in terms of the speech, which you are expecting after doing the stem cell therapy in Neurogen. So what it benefit to my kid from your stem cell therapies?
From this technology, you should understand there's a big difference of treatment at Neurogen.
Is it different? One other question. The one you're doing is different from the Alok Sharma, or is the same?
Much different. You have heard everything, what we do. We map the brain, we target the brain, we use the growth factors, we use the peptides, we use the quantum energy medicine, we use the VACL cells, we use the progenitor cells, we use the cells which can target the brain to improve, and the changes you can see in 3 weeks' time, not waiting for 3 treatments or 4 treatments.
He also said that we had a PET scan. We had targeted the area where he is supposed to be carry out.
I cannot comment on somebody else's treatment because you have an experience. Then again, if I can comment on that, it will be not good for me.
Yeah, I understand that one. Yeah. No, we're trying to comparing with your things.
So that is what I'm telling you. Here is the treatment program of 15 to 20 days, and where we map the brain, use quantum energy. That transcranial stimulations is the most important target which you have seen with us. We remove the bacteria from the intestine by using fecal microbacter because there's a neuroinflammation. Then we use intravenous dose, which is very important to reduce the inflammation in the brain. Then we use intrathecal road cells to build up the communication in the various parts of the brain. And then we use nebulization of the stem cells from the nose to reach to the brain. You got to understand the difference now? It is just not giving a bone marrow. There are many components of the cells which we use here. Is it clear?
Yeah, it's a 15 to 20 days program, yeah.
So you understood the difference now?
Yeah, understood now. You're showing like not only with the PET scan, so not only the bone marrow, you're injecting the stem cell therapies. So you are using different therapies you are talking about, yeah.
Yes, there's a big difference. So you cannot compare and I cannot comment on other treatments. Because if I say I can give changes in 21 days means the child will start showing changes. Because it is not generalized treatment. There, wherever you go, they give generalized, just put the bone marrow and send you home. It is not that stem cell treatment. It's a mononuclear cell treatment. And it is a bone marrow treatment. It doesn't have any kind of potential to repair the brain cells. Here we use a transcranial technologies where the neuron has to start firing. Understood now?
Okay.
Is it clear for you, sir?
Yeah, thank you, sir. And let me talk to my wife. And if she got any questions, she will ask you. Yeah, give me some time.
Please. No
Thank
problem.
you.
Any other questions? Any other questions? Mas, can you invite the questions?
So, dear participants, if you have any questions, you can ask or post your question in the chat box.
One more question, sir.
Yeah, please.
What is the cost of this one? Like, 15 to 20 days program you were talking about. Is there
Maz looks after my all patients. He will communicate with you logistic as well as the entire program as the costing plus the logistic system. Maz will guide you. Maz, please take care of the entire subjects who wants to take the treatment.
Yes, definitely. I'll get in touch with him.
Okay, thanks a lot.
Gene replacement therapy है क्या कुछ?
Is any possibility of
Gene replacement therapy.
gene replacement therapy, sir?
My dear friend, gene replacement therapy in this condition is not indicated because there is hardly any genetic role.
Why? Because we had here in the here where we are staying, we had with Oxford tie-up with the NHS. One of the doctor has been done the.
My
What you-
dear friend, there are no defined genes still responsible for autism disease. If we have say something, then it is wrong. I can
No.
always defend it.
Hello.
Yeah, go ahead.
Yeah, they said my son got NRXN1 gene deletion. They said like that.
No,
when
there
we
are
had
very
tested-
fair. I told you in my presentation, if you remember, I told you there are very small cases. In my presentation, I showed you there are very rare genetic representations. Now, this deletion has affected specific development, but not as an autism. Understood?
Yeah.
But not as an autism. So this deletion can be corrected by using mRNA, that's StemRx. So this is not called a genetic disease treatment. It's called we use mRNAs to repair those deletions to add it.
Is it possible in India this time?
This is possible with StemRx in India. And this is possible only to fix up that you will see the physical changes coming in the child in emotional behavior, in the growth pattern, in the communication skills. If he is non-verbal, he will start become verbal. If he is babbling, like making noises, I'll make him making voices. You understand noise and voice. Noise
Yes.
is babbling.
Because-
Voice
because
is
why-
purposeful speech.
Because my son got global developmental delay. He didn't diagnose with autism.
If global developmental delay is a total, I'll explain you. Global developmental-
delay and
go ahead.
they said he had a gene deletion. He tested my blood and my husband's blood, and they said there is a half part of a deletion from mother's side and half part of a deletion from father's side. They said like that, but in his career, in his 25 years of career, he's seen only 2 children. Like my son, one child is completely physically disabled, and another one is my son, he's babbling, he's talking, he's going to school, not talking, babbling sounds, but
Yeah.
he's not going to, but he's completely dependent on us, he's completely dependent, washing, everything I can say. But is it possible, if any chances, we can send the reports to you, and if you look at the reports and you can get back to us?
I'll appreciate. Must please collect the reports of gene deletion from her.
Okay.
Give a definitive answer to her.
Okay.
And what are
Okay.
the changes? Also collect from a small video of the child. Then we can
Okay.
get definitive changes in the child, how we can bring them.
Okay.
Okay, ma'am?
Okay. Sure.
Really thankful for you.
Thank you so much, sir.
Thank you. Any other questions?
Dear participants, if you have any questions, you can write it in the chat box.
I consider most of you understood.
Is it possible to send this presentation to us to email so that we go through that one again?
This presentation you will not understand. I can do one more presentation for you.
Okay, why? Because I understand half of the part. When you come to the speech, that part went very fast.
I'll explain you again. At a speech, usually what happens, the children have a babbling. Means they can make the noise.
Can you show me that presentation as well?
I'll show you. We go back there 1 minute.
Thank you.
I'll get to the same slide. Now the difference I'll show you. Here we have so many things what we do. FMT plays a major role. Mitochondrial resetting function is very important. Understood? Now here I'll demonstrate. See, these are endogenous cells present within the brain in the areas which I showed you. And these are the stem cells which I use from outside. Okay. They are the areas of the brain where the cells are present. I activate a using transcranial activate stimulation for these cells.
This is the one.
This one now. Here, now speech area I'll show you now. The babbling is present. I'm showing it with arrow, the area of the brain where this babbling, if you see the alphabet doesn't have any sequence here. Understood? This is called a which works out from this area. But this speech therapy is working here. It doesn't make any sense for me. But the processing of the language takes place at this level of the brain, which is called the vernix area of the brain. Once the language is processed, they inform to the motor area of the brain to specifically produce specific language, specific word. Understood?
That's correct. Yeah.
Why this noise becomes voice. So we have a special technology here to connect this area from processing area to the motor area, which is called the intonation program. Intonation program, where this processing area will start processing the language and the motor area gets the information what the child has to speak. Got it now?
Yes. Thank you, sir.
Please. So wherever you go in the world, you will never get this detailed workup on the child.
Yeah. To make it endogenous program, so which are the therapies you will be carrying out on this one?
Very good. To make the indigenous cells to work more, I'll be working on quantum energy medicine. I'll show you. Now, as I said you, we will be using this many type of cells. Understood now? Neuroprogenitor cells, small mesenchymal cells from various sources, and growth factors and peptides. I'll show you the therapies. We will be using the pressure chambers, hypoxia. We'll be using high pressure intensity waves. We'll be using magnetic resonance therapy. We'll be using, this is particular cellular effective therapy, electrical impulses to generate in the body. We remove the inflammation from the brain. We use the ozone therapy. Apart from that, this is the most important technology, fecal microbiota transplant, where the bad bacteria will remove and put healthy bacteria inside. You got to understand what is the difference now?
How we fecal back? How fecal?
This is done by using bowel washes, by using bowel wash technology, and then infuse the healthy bacteria by using either endoscopy or enemas.
Yeah, how FMT will be affected to the brain?
My dear, brain FMT is important for the reason the basic cause of autism is starting from the intestine, because we have bad bacteria. This in general, children will have always bad intestine, where they'll be constipating, having all issues of discomfort of stomach. And these bad bacteria, which are called as Clostridia difficultis bacteria, they lead to neuroinflammation through a terminology called as gut-brain axis. If you repair the gut-brain axis, gut is a second brain taking all the neurological cytokines to the brain. And they set up the inflammation because the macro proteins, if we change the microbiota of the intestine, the neuroinflammation will get repaired automatically. That's the reason this particular technology is very, very important when you treat. Just not giving a bone marrow is going to change the neuroinflammation. Is it clear for you?
Okay, got it now.
Next question.
No side effects? No side effects.
I told you no side effects, no complications.
Okay, thank you.
Because we already had done a 3 stem cell therapy in Mumbai, and we didn't see much improvement on that.
I cannot comment others' benefits.
Okay.
I will
Okay.
comment on the treatment, what I'm doing it. Because
So
if that
how
treatment was
many days
correct,
program? Like
15 to 15 to 20 days. Okay. Okay, thank you, doctor.
thank you so much.
pleasure, sir, pleasure.
So there is no more questions in the chat box.
Thank you. Thank you for participating in the webinar. You're always welcome. You can always connect with them whenever they need. Thank you.
Okay, thank you.
So much.